The danger of misinformation around health will lead to a lot of people dying, simply put, because we got to remember, we live in what's called a free society, and people can say what they want. And we're at a moment in time where electronics, social media is all around us. And if someone has the right platform, they can spread misinformation and it becomes a poison. And in my opinion, that's pretty much what has happened with COVID. My name is Dr. Darrell Hill. I'm an internist with offices in Laurel, Maryland and Silver Spring, Maryland. I'm a graduate of Rutgers University and Rutgers Medical School, and currently enjoy managing and treating patients and developing incredible relationships in helping my patients stay healthy.
Hello, my name is Dr. Catherine Kelly. I am a two-time graduate of the Howard University in Washington, D.C., where I received my bachelor's in biology and anthropology, as well as my medical degree in 2007. I currently am the owner and president of Kelly Collaborative Medicine here in Silver Spring, Maryland, which is a primary care practice focused on health, wellness, and community service.
Hi, I'm Dr. Gordon Taylor. I'm an emergency room physician, and I've been practicing for the past 11 years.
We've seen an insidious delivery of information to all segments of society that has transcended politics, in some cases religion as well, to the point where people are petrified to make a decision that should be very simple, keeping in mind that as you look across the entire world, other countries are begging for this vaccine that we turn our noses up at and get into political discussions which ultimately are leading to death. And we can talk all day about politics, and I don't want to do that, but I will say that when this whole pandemic started, at the highest levels of our government, there was significant misinformation that came out that got this whole issue of getting the vaccine, got it off on the wrong foot and made it very, very difficult.
The risk of death with this virus is high if you're not vaccinated. And just because this time you didn't get severe symptoms doesn't mean if you get it again that you won't get severe symptoms. I've had COVID. It was probably the sickest I've ever felt in my life. At day 7, I really felt like I might not get better. And so there's some comfort for me in knowing that I'm vaccinated and that it decreases my risk. The other thing we have to remember is that other people have other reasons to be hospitalized, so we kind of miss out on some of these points about people getting severely ill from this illness, and they're keeping people who would otherwise not have issues that are COVID related from getting access to resources. So some of you being vaccinated and taking care of those kind of things is not necessarily because you're going to get sicker. It's because overall we're helping from a community standpoint of us getting out of this pandemic and making resources available to those who are not sick with COVID. People who have heart attacks, people who've had strokes, they also need urgent hospital level care. And again, as the virus mutates, just because this time you didn't get sick, the next time you may get really sick and you have to be the person that's taking up a bed in the ICU. And why take that risk when you have something that's been proven to be safe and effective against severe hospitalization, severe symptoms, and death? Get vaccinated.
So I went to a HBCU. I know the trauma that our community has dealt with for several years. I remember Macon County, Alabama, and the Tuskegee experiments. That scarred several people for several years. They don't trust the healthcare system. However, the COVID-19 vaccine is safe. I do believe in it, and I've received it, and I think it can save many lives. I encourage you all to go and get this vaccine. Help a loved one, help yourself, help us all, because we're in it all together.
Listen, talk to your healthcare provider, and get the vaccine.
Listen, talk to your healthcare provider. Get the vaccine.
Listen, talk to your healthcare provider. Get the vaccine.